Somebody comes up to you and says, I'm really interested in being an entrepreneur. I want to be the CEO of a startup. What advice do you have for them?
Are you crazy, first of all? Have you wanted to be an entrepreneur your whole life? Were you doing entrepreneurial things as a kid? Really look internally to yourself. Don't force yourself into it unless you have that idea.
We are really excited to have Erick McKesson, who is the CEO of Rotera AI, joining us today. Erick, very nice to meet you.
Yeah, nice to meet you as well. I'm glad to be here. It's been a great conference so far and really looking forward to our conversation and the rest of the week.
Yeah, if we were talking before we actually started on the podcast, you've been really busy with meetings, and I'm assuming that's customers and investors.
It is. We took advantage of here. They have the funding founders rounds, and then they have the buyers program as well. So you can pre-book with both VC firms and with health systems, and we really took advantage of that, filled up the schedule. And then outside of that too, just booth traffic and people reaching out to us directly wanting to schedule things. So it's been really, really active on both sides, which is great for us. And
awesome.
Good environment overall.
Is this the first conference you've been at for the company?
We were at HFMA over the summer.
Yeah.
We do a lot in the revenue cycle space, so we had a presence there. And then we were also down at 5
awesome.
in March as well.
Cool.
Yeah.
This is amazing, though, in terms of how much bigger it is compared to Vive.
Yeah, compared to Vive and even Health last year, this feels like it's double the size.
I agree. And it's interesting. Not everybody who was at Health last year is here this year. So there's been some changes. So, what the title of this podcast is Solve, and what we try to do is talk to founders about, the problems that they're trying to solve. I mean, you walk around the floor here, if you look at it, there's a lot of problems in healthcare. We know that there really is. So tell me a little bit about the problem you're tackling.
Yeah, the problem, I always start too broad and people say, well, what are you really solving for, right? Because we are a platform company. We're building a platform that can solve a lot of different challenges. What we're building is a digital assistant that can, be plugged in to help bring data to people, make accessing information from disparate systems much more efficient. And instead of context switching and jumping between systems, you've got it as a sidebar, something that you can quickly reach to while you're in the EMR or while you're in an ERP. So we're trying to solve that. Now, a really specific theme is really in the scheduling space. It's where we do most of our work today. And, interestingly, we found that some of the most large health systems out there, even those using Epic, are still managing spreadsheets of data in the call center. And they're using that as their tips and tricks, but also for actual provider data. What are the preferences that are unique to their organization that they have to track and that actually get updated every single day? And so spreadsheets are obviously not the best way to do that. We've been solving that through kind of aggregating it through, making it searchable content, and then displaying it on our desktop assistant application.
How did you get here? What got you into doing this?
Yeah, I've been in the health tech space, I guess, 16 years now. I started off at Epic. I spent about 4 years there. I've got an entrepreneurial spirit in me, I think. And so while I was there, I did a lot of the early things. I was one of the first people to lead their model system, the foundation system now. They're rethinking how do we deploy the EHR. I was their first single billing office implementation, which was merging hospital and physician balances for the patient. And then also their first hospital community connect. So if you think about how we connect from a hub health system out to rural hospital systems, I was really leading one of the first ones of those as well. So a lot of new interesting things that happened at Epic spawned my career. And then I jumped into consulting from there. I wanted to understand operations better and really dive in there. So got into revenue cycle consulting. Was actually a part of a subsidiary of Multicare Health System out in Tacoma. We eventually did a management buyout of that and became an independent consulting firm. Went through a successful exit back in 2016. So spent a little bit of time in publicly traded consulting at Navigant. And then started my first really out of the box venture with Vendy, which we were trying to solve. How do we we were building the Yelp of provider vendor selection,
right?
And trying to help providers really communicate with each other and be in control of the message they're getting versus receiving third-party reviews and everything like that. So it was a dual-sided market, very challenging. I learned, and I'm crazy because I think there's maybe a future for Rotera to have a marketplace as well, but I'm going to do it in a very different way. We had a lot of vendor traction. Everybody's looking for ways to sell. And so there was a lot of vendors signing up for it, but the provider side was really hard to get engagement from. And so, we went through that, which ultimately led me to running into Olive. And I was really interested in automation, had done some of it in my consulting days, and decided, hey, let's take a shot at this. Really started to focus on how does Olive start to, move from all custom solutions into products. And ultimately, I think the itch was getting to me again. And I was like, I want to do something else and think about building from the ground up again. And started Rotera early last year from there.
That's amazing.
Yeah, it's been a journey.
And you're up to 14 employees now.
We're at 14 right now. Yeah.
That's awesome.
Yeah.
And so what keeps you up at night? I mean, it's a small, this is we'll call it brand new. It's not quite brand new, but that you've run headlong into some macroeconomic challenges. There's been, I was going to say there's been talent acquisition issues, but that seems to maybe be improved a little bit with some of the big tech layoffs that have been occurring. So what are the big challenges that you face as the CEO of this company?
Yeah, I mean, the number one thing that keeps me up right now is absolutely budget and revenue generation. I think we've bootstrapped so far, and I would never recommend it to anybody. It is definitely going to keep you up at night. So you're constantly every day looking for how do we get the next sale, how fast is it going to come through, and when you're in an environment where sales are not always predictable, which is very much healthcare,
and not terribly quick either.
And not terribly quick. Yeah, exactly. That definitely keeps you up. And so, you feel like you're getting close always, and then something sets you back, and then you've got another one coming, and it may set you back. But we've been managing that conflict, I think, really well. But it is something that I'm always thinking of. The other one is really on the customer side. I mean, I want to make sure that we're doing everything we possibly can to really make the customer have a wonderful journey with us. And it's challenging. There's more than just implementing your product and getting your product out there. There's so much about how do users actually engage with it. What's the actual customer experience? How do you manage change management? And are people adopting to a new way? Not just within the department maybe that you're impacting either, but how does leadership in other departments and end users in other departments potentially have downstream impacts from the work that you may be doing with a single department on a product? So there's a lot of moving parts there, and I think we've been focusing a lot on how do we build that program and make it seamless. But we're as an early company, there's always learnings there and small things that you look back on and say, man, we really could have done this a different way. So
do you ever struggle with the tension between wanting to deliver a product and then also feeling like there's got to be a professional services component to what you do?
I do every day. It's funny. There's been a couple conversations I've had this week where I'm like, have you been stalking my LinkedIn? Because I actually had a post about this the other day where I said, I don't think that SaaS, enterprise SaaS, especially in healthcare, can survive without services. And if you think about it, even an Epic or a Cerner or any of the big enterprise companies, I mean, they have armies of services, whether it's internal or external, and still a lot internal. And it's necessary to get the adoption that you need and the change that you need and to fully embrace it in the organization. And so I think there will never be a world where almost any SaaS solution in healthcare can survive without some degree of services. I think in the automation space, it's why, a UiPath, for example, or an Automation Anywhere offloads all of that onto third parties, right? They know it's necessary to be successful. They don't want to have it on their books, and so it's, hey, let's build an extensive partnership network to make that the goal, and also move some of that service work into the sales realm, in sales engineering, right? So, it's a struggle. Definitely, we intend to provide a degree of services all the time. I call ourselves a services-enabled technology company rather than the other way around. We think there will always be some degree of that on our books that is necessary to make our customers successful. So,
how do you find health systems as sort of being a fertile environment for the whole concept around automation and even AI as a tool of automation?
I think a lot of them struggle with it. I think it's the reason why an AI as a service model took off several years ago. was that there was a push to say, especially from an operations perspective, we need to adopt this. We need to reduce cost. We need to find ways to automate, but we don't know how to do it. And so the focus was on, well, AI as a service is a great way to get there. We just give it to someone else and they'll handle it for us.
Right.
I think the reality of that is, well, then you don't have enough of that internal management and the change aspect I was kind of hitting at.
Yep.
To actually fully adopt it and embrace it internally. So I think it is a big challenge. I think if you do it well, and I think this is where consulting firms really can dive in. I haven't seen any do it extremely well yet, but if they use the way that they thought about process change in general, the Deloittes and McKinseys and Navigants and others of the world could dive in pretty deep there and say, well, let's actually embrace this change and do it at an enterprise level together, and do it slowly and not have to rush it, but over several years start to grow it. I think that's key. But we speak often the mantra of empowering the health system.
Mm-hmm.
I think it's really important. My view on it is that you don't go in and say, well, build it, maintain it forever, and that's that. It's we're going to come in and we're going to talk about governance. We're going to come in and talk about change management. How do you prioritize? How do you evaluate ROI? Where are the real hard savings versus soft savings? And what does that mean for you as an organization? If one department wants X and another department wants Y, but there's limited resources, how do you manage the conflict between those? And really set that center of excellence, I think, is key to making it happen and be successful. Now, then you can have a wild environment where you can say, okay, there's hundreds and hundreds of opportunities that we can think about. In my past, I like to use those as ways to then say, all right, we found 200 different things here. What are the ones we really want to latch onto? And now how do we convert those to become products and now start to have a SaaS model around it? So, which is really part of how Rotera came about. And our digital assistant platform was through a lot of those learnings. So,
how do you find the experience of being an early stage startup pitching healthcare as a legacy industry that exists? Have you had challenges in terms of people taking you seriously, wondering if you're going to be here tomorrow? How does that affect your pitch and your sales cycle?
There is some of that. I think I feel it way less than I used to 5 or 10 years ago.
Okay.
I remember there being times at McKinnis where we were getting people asking for our financial statements and everything else to actually audit us and figure out will you be around.
Right.
I haven't had that anymore in the past several years. But I do think there's still some hesitancy. I think in the past couple years, it's really been embraced better and really through these innovation arms that have been spinning up. I think almost every health system seems to have an innovation fund and a transformation team internally, right, where they are looking at new ideas, novel ideas, and or smaller companies that they think that they could help have an impact on and be a part of the journey of building the product, and then hopefully generating a revenue share together as well over time. So I think through those changes and the amount of that we've been seeing lately, the entry point for startups is way easier than it used to be.
Interesting. How do you balance the sort of where you are, in the stage of the company in terms of new business and having capacity to manage that new business? So you're managing your shekels pretty closely. You're not going out on I'm going to assume you're not going out on a hiring spree because you don't have the cash to do a hiring spree. But at the same time, that's a little bit of a rate limiter in terms of how much business you can handle. How do you, as the leader, sort of balance that?
It's a really good question. I mean, we are looking from our sales pipeline perspective today. It's where's the pipeline? How close is it getting? When we get to a trigger point, say 90% confidence, then we're rapidly going out looking for staff to fill it, and training them and onboarding them. But we're also not hiring junior staff. We're only hiring people that have worked in the space, understand the space, have been in healthcare, and will be an easy transition for them. I think that's critical for that model to work. So that's one thing. I think. I don't know. That's probably the biggest thing we're doing today.
Have the big tech layoffs of late made that easier for you in terms of finding that
hasn't
more senior
impacted us
talent?
yet.
Okay.
We haven't been hiring for the past couple month or so.
Right.
So there haven't been any immediate impacts from that. Some of the early ones in the summer we did pick up staff pretty easily off of, which was great. The talent pool expanded for sure. Not great. I mean, horrible that it's happening, but
it's a double-edged sword for sure.
But absolutely, yeah.
Somebody comes up to you and says, "I'm really interested in being an entrepreneur. I want to be the CEO of a startup." What advice do you have for them?
Are you crazy? First of all, Have you wanted to be an entrepreneur your whole life? Were you doing entrepreneurial things as a kid? Is a good question. I think of myself like building fortune boxes out of cardboard boxes as a kid, and charging kids to climb our tree and stuff. But I mean, I think start with that. Really look internally to yourself. There's been some people I've talked to in the past that say, I really want to create a startup, but I don't know what to do. And I think don't force yourself into it unless you have that idea that you said, I have a spark, I know what it is, and I'm now willing to take the risk. I'd also say talk to a financial advisor and figure out how long of a run rate you have for your own personal finances.
Yep.
And say, can I go 2 years or 3 years not making any money and still retire on time? And if the answer is yes, then you probably have a good shot at it. Or you need to right away, start with funding and have that great idea, obviously. So I know those are a couple things I would think of. Be prepared not to sleep. If you have kids, figure out how to manage that relationship and with your spouse as well, and set boundaries for yourself, to keep yourself healthy and your family alive and all that. I don't have kids, so I do have a wife, so I have part of it, but absolutely, I think that's it's key. People leave that on the side a lot.
So when I look around this exhibition hall and I see all these people solving or providing solutions, it begs the question, okay, that means there's all these solutions, so there must be lots of problems. So what I like to ask people, in terms of these problems, is healthcare broken? Is it irrevocably damaged? Or is there an opportunity for a company like yours to come in and really begin to solve some of these problems?
It's an interesting thing. I mean, you have a really good point that there are thousands and thousands of point solutions. Something I think is important to make this work and be effective is that we start to think about some degree of consolidation more into platform ideas, and like, how do we have 7 or 8 robust things that we can build those 1,000 things on top of, instead of having patchwork of infrastructure everywhere. There was, if you think of the EHR boom, prior to that, point solutions everywhere, right. Consolidation happened, then it kind of imploded back into point solutions. I definitely think in the AI and automation space, there's a desire for health systems right now to start to think about how do I bring that in and have control and, do it more in a platform way, which I think will be more impactful.
Yep.
But I do think fundamentally, outside of, all of these problems that may exist, there are some foundational things that are going to be key to making healthcare work in the long run. And I still don't feel like the payer-provider relationship component is appropriate and working well. I personally have a little bit of a I don't know how I feel about for-profit insurance in general, if you will, even though who knows if the government regulation for it would be the right thing or be able to solve the problems either. But there's a disconnect there between, are we solving for a patient or are we trying to make money? And I think that'll always be core to breaking parts of healthcare in the U.S. at least. So I don't know. I still have high hopes for the future, and I do think that everyone here is solving very unique challenges that will make things better today. But we have to think about that longer term picture still, and how do we all work together and collaborate. One thing I also preach a lot is like, we should between everybody that's here in the conference on the exhibit floor, stop looking at ourselves as competitors. And really, really focus in on the collaboration. And I mean, like, true collaboration. We're working together to solve the same thing and not thinking about, well, what's my share and what's your share as much. And I think that'll be really, really important to have impactful change too.
Yeah, and I think you bring up great points, because in my mind, the biggest obstacle to, sort of achieving progress is that the status quo just meets so many needs. And even if you think, individually in terms of the way that we may invest for our own retirement, we've got pharma, we've got health system, we have for-profit health system, we got payers in our portfolios. And so even at the individual level, we're conflicted as well, even though we're all here trying to solve these particular problems. So it's a huge conundrum in my own mind in terms of how do we get, to your point, the collaboration that's really necessary to begin to cone down some of the or reduce the breadth of all these solutions and sort of say, what's the most important thing for the next 5 years to get done? What's the most important thing for the next 7 years? And have and as an industry come up with a roadmap and some milestones that we can at least look at and say, are we moving the needle? Because when I come to a conference like that, that's the question that I always have. It's like, yeah, there's a lot of money here. There's a lot of really great ideas. There's a lot of momentum and optimism.
Yep.
But are we moving the needle? In 10 years, will we turn around and we say, you know what, when we were sitting here talking, did we make a difference? And that's why I got into this, because I wanted to make a difference. I wanted to make a difference at scale. As a physician, I made a difference every day I, saw a patient in the office or saw them in a hospital bed. But I really wanted to be able to do it writ large and say, how can we take this system that has dysfunctional components and make it more useful for all of us? Because we either all are or will be patients. And so it is a bit self-serving.
Absolutely.
Yeah.
Yeah, I can totally understand. I mean, there's a direct correlation between your own personal future and abilities and how you work in the business world and all of that, and that often leads to people butting heads and not wanting to work together on things, and we do have to break it down and figure out how do we solve for that. So I think there are a lot of people out there starting to build these roadmaps of what does the future really need to be. I just don't know if it's hard to imagine exactly how we're going to get at a regulatory level to a point where we can see eye to eye and agree on the way to move forward too. So that'll be a challenge.
We'll talk about that next year.
Yeah.
Erick McKesson, CEO of Rotera, thanks for coming by the podcast today. Appreciate it.
Absolutely. I appreciate your time and hope you have a great rest of the show.
Likewise. Thank you, man.
Thanks.
Appreciate it.
Yep.